Welcome to For Your Health, the podcast where we explore urgent health issues and the solutions that shape healthier communities. I am your host, Dr. Rhonda Marie Chakolis-Hassan, and today we have some very special guests. But before we dive into that, I just need to let you know that the views and opinions that I will be expressing are my own, and they don't represent any of the entities that I am affiliated with. Today, we are pressing into a urgent public health issue, the opioid epidemic. This epidemic disproportionately affects African American people, Indigenous people, and people of color across the country. But today, I'm really excited because so often we focus on the problem and not the solution. There is a new treatment option called Brixadi, and it's offering hope to our community. Join me today as I have Commissioner of Health Damōn Chaplin from the City of Minneapolis and Heidi Ritchie, Deputy Commissioner. So welcome, and if you would take a moment just to introduce yourselves.
Good afternoon, Damon Chaplin, Health Commissioner, Minneapolis Health Department, by way of Massachusetts. I'm wearing my Celtic green today in support of Mental Health Awareness Month. We were in green, so I thought it was appropriate to wear my Celtic green. From Massachusetts, been here for just over 2 years now, and just still learning the community and learning all the partners.
Well, hello, my name is Heidi Ritchie. I'm the Deputy Commissioner for the Health Department. I've been with the City of Minneapolis for just under 20 years and with the Health Department for about three and a half. And this work around the opioid response is part of my work portfolio that I oversee for the city.
Thank you, and it definitely shows that you guys both bring your public health expertise and have a deep commitment to solutions. So let's start out with some questions. Can we briefly talk about the state of the opioid crisis in Minnesota? And can you describe what you're seeing in communities?
Yeah, I'll go first and then look for Deputy Commissioner to jump in as well. Um, we have nationally, we've seen a decrease in opioid-related deaths. But locally, within the county and within the city, we're seeing a slight increase, particularly among our African American and Native American communities. We're seeing increased use at many of our encampments or um, um, open encampments. And so we've seen this increase over the last year or so, and we're trying to get ahead of it. And so we we have this opportunity now in front of us with this new drug, Brixadi, and then also with the medical mobile unit with the Deputy Commissioner. Richie will talk about where we have an opportunity to kind of get it in the hands of the people that need it the most. And so if you have a family member, as I have, who are struggling with this, you understand the challenges in being able to communicate and engage with folks. You have a small window of time between either when they're in withdrawal or when they're in euphoria to kind of engage with them and really have meaningful conversations with them about treatment and recovery. And so, with this new treatment, this new drug, we're increasing that window of opportunity to engage with folks and get them into long-term recovery. So I'm actually very excited and so happy that you invited us to have this conversation.
Thank you, Deputy Commissioner.
Thank you. I think, when we think back to when this work first started in the city of Minneapolis, which was in 2018, really, we were looking at addiction to pills, to oxycodone and those types of things. And so, just in a few short years, we've seen a change in the consumption. So, it's really the fentanyl that we're seeing, which is extremely potent and hijacks the brain in a very pervasive and persistent way. We also see that the fentanyl can be laced with other things. So we're seeing issues with tranquilizers being added to the fentanyl, and that causes additional concerns and issues like wounds. Open wounds can be an issue with that. And then it also, when you're looking at overdose reversal with the naloxone, which is the drug that we use for overdose reversals, that is not effective for non-opioids. And so the trends are going in a direction that is more pervasive and persistent. but there is hope, and I'm so glad that we're able to talk about that in the rest of the questions.
Yeah, and I'll just interject for the audience member who don't know, I am actually a practicing pharmacist. So I started out in what I would like to call the Oxycontin years. I got my license in 2009. And I would say historically, communities of color did not think the opioid crisis affected them because we didn't have access to the prescription medications because of the way pain was being treated and the disparities surrounding that. And then fast forward, because we did not think it was our problem, we just went straight to fentanyl and heroin. And so, very often when I'm talking about these issues, I make sure that we really highlight, like you did, and say this isn't really just related to pills. So thank you for that response. My next question is really about, as you kind of highlighted, this crisis really demands that we have a comprehensive all hands approach. How has your department responded to the opioid crisis in recent years?
Well, I mean, I guess I can go back to 2018. Like I mentioned, that's really when the city of Minneapolis decided to enter into the space of responding to the opioid epidemic. And so in 2018, we convened a group, a multi-jurisdictional task force with people from the city, from the state, from the community, providers, people with lived and living experience. And they kind of organized themselves into four subgroups. And they did a lot of work to come up with some priorities and recommendations on how to address the opioid epidemic within those four subgroups. And that was um, published in 2019. And between then and about 2022, we were working on those priorities. And some of those included a hospital based intervention. So, folks that overdosed and went to the hospital would have an opportunity, someone would approach them and give them an opportunity to get on medications for opioid use disorder or go to treatment, more traditional treatment, or things like that, or even wraparound services. We still have that. It's called the First Step Program. So that's the hospital based intervention. Other recommendations and priorities that we saw were culturally specific things like prevention, culturally specific interventions, and then culturally specific treatment and recovery processes. So we've been doing the work based on those priorities. Then we got the opioid settlement funds, and those started coming in 2022. So Minneapolis receives, we're going to receive about $18 million over 17 years in disbursements between 800,000 to a million a year. And that's part of the national opioid settlement. And so with that, we put together an opioid strategic plan and worked with the community and with a consultant to come together with those recommendations for the strategic plan. And some of the same things that came up during the subgroups, most importantly, I think, is the piece around cultural relevance and cultural specificity. Those things keep coming up year after year after year. And then also just the cooperation between the city, state, and the county to make sure that the dollars that we all are getting from opioid settlement funds and then also the investments we get from our other funding sources are being supplemental towards each other because this problem is bigger than $18 million. It's bigger than $50 million. And so we want to make sure that we are supplementing each other and working together collaboratively to, for lack of a better phrase, get our biggest bang for the buck. And then also make sure we're not duplicating services.
Commissioner, is there anything you'd like to add before?
No, I think that's pretty much it. I mean, when you talk about a comprehensive approach to this, we're talking about all hands on deck, and we're talking about sharpening the spear, so to speak, the tip of the spear. And so, when we say that, we want to be very intentional about the direction that we're going in. Being culturally specific, we use those terms a lot. You hear that a lot, but we're really talking about the flavor. You know, it's not just about the ice cream, but it's the flavor of the ice cream. and how does this really is it the right prescription for the right problem? And so it's not a one size fits all. And so this problem is too complex for us to think that we can do it with one shot. There's no single shot method to this. So it's important that we have input from community partners, those folks with lived experiences. I think when you look at the strategic planning process, they did a really good job of engaging with communities at multiple different levels to make sure that we were getting a very comprehensive input. And so that qualitative report was very, very helpful. And we use that report to kind of complement the work that the county is doing. And then that work is going to help to advise some of the work that the state's doing. And so this is really, in my opinion, uh, this is a this is a comprehensive approach to a very complex adaptive problem. And so again, we have not only do we have the science behind us now, but we have the framework and the organizational structure to really make a difference. So I'm super excited about what's about to happen.
Yeah, and I will say, as a community member and a pharmacist, I'm actually really excited about this. One of my frustrations historically is we have a lot of Narcan or naloxone saturation. What I do know clinically is if you don't pair that with treatment, people who have that overdose reversal are actually more likely to die for an overdose. And so I really commend the city of looking at this issue from a comprehensive, person centered approach. So, my next set of questions is really exciting for me because I want to talk about innovation. If any of you could tell me more about Brixadi and then kind of tell me how it's different from methadone or daily buprenorphine or Suboxone.
Yeah, I can take a shot at it, and then obviously you are a pharmacist, and so hopefully I don't
The expert.
I don't say something that you have to correct. I think the biggest differences between Brixadi and then the methadone or the Suboxone that we see regularly treating addiction is that instead of a daily pill or a daily dose, Brixadi can come in an injection, and so it can be a 7 day or a 30-day injection, which I think is really helpful for people who have busy lives and are trying to function. The other thing is storage. Can be an issue with the Sublocade shot. It's very viscous and thick. It has to be refrigerated, and so it's a little bit more painful of a shot. So the Brixadi, it doesn't have to be refrigerated, so that helps with storage and with transportation and things like that. And then it's not as thick, and so it's an easier shot. It can also be um, you can administer the shot in different areas on the body, whereas with the Sublocade shot, there's only one place that it can be administered. So I think those are the biggest differences that I can think of. But if I miss anything, please let me know.
I think you did a fantastic job. I think it's important when we talk about these issues to say it in a way where people can understand it. Again, I bring my pharmacist background and I think about some of the problems that we're seeing in community in terms of reduced access to pharmacies with them being closed,
Mm.
limited access to pharmacies. In particular, in Minneapolis, a lot of pharmacies are closed on the weekends. Substance abuse or other medical conditions aren't conveniently Monday through Friday, 9 to 5 or
Mhm.
9 to 6.
Mhm.
So this does offer people a quality of life opportunity and also kind of gets past some all of the regulatory things. So if something's not in stock and a prescription can't be transferred.
Mhm.
And so as a pharmacist, I'm really excited about that and how it really can help people live the best version of their lives. And so, my next question is what really inspired the city to pilot Brixadi? And when I say that, I also think we should just be very clear about how people can receive it, if they have to pay for it, etc.
Yeah, that's a really great question. I think what inspired us is we just heard about it, and our project manager, Suzanne Young, for the opioid response team, is really the one who was like, "Hey, there's this new thing out there called Brixadi. We should take a look at it." And so we started educating ourselves on it. Dr. Ronda, you helped with that. Dr. Deziwe Nakaba from M Health Fairview, who's one of our partners in this pilot project, has also helped us educate ourselves around this. And then we had to figure out what the regulatory framework has been around generally medications for opioid use disorder, but then this Brixadi as well. And then figuring out what those barriers are and how we can work within them, or if we need to go to the legislature or our federal partners to try and lobby for changes. Right now, it's challenging. The commissioner mentioned the mobile medical unit. We would love to be able to administer Brixadi from our mobile medical unit. Right now, that is challenging because my understanding is it needs to be out of a brick and mortar facility. And so those are some of the things that we're grappling with, but we think we can make it work. And so this pilot project that we're doing, we're partnering with Riverside Emergency Department, M Health Fairview, with our Native American Community Clinic, and then with Hue-Man Partnership and the LA Park Neighborhood Association in order to um, get Brixadi into folks and then also make sure that we are able to follow them. So it's not just a one and done shot. So it's something that we can hopefully provide the treatment and then support them in their long term recovery.
And Commissioner, anything you want to add on that?
Yeah, it gives us a fighting chance, right? Um, we underestimate. I think people underestimate the strength of the drug supply right now. And fentanyl is much, much stronger than the drugs that I grew up on, or folks listening may have grown up on. And so this new opportunity it opens the window and gives us a chance and gives the people who are involved a fighting chance. And we want to be alongside community for the long haul. And so it's not just about getting this product into the field, it's about getting people to recovery and for me into reentry, re-entered into community and reestablished with families. Real recovery happens when relationships are recovered. And so for me, the bigger the purpose of the individual, the bigger the recovery. And so this gives us a fighting chance to open that window between, when a person is either in euphoria or when they're in withdrawal. And so it gives us a chance. And when you talk to folks, there's two things. If you talk to folks in recovery or in the recovery field, there's two things they talk about. They want folks to have options, right? And they want the options to be available when they need it. And so you always hear folks talk about, well, you have to wait until they're ready. Well, this gives us a much bigger window of readiness. And so those are the things that I think are just exciting about this opportunity. And we're doing it, we're slow walking this so that we can measure it and monitor it over time and we can evaluate the safety of it for the communities. And we want to make sure that we have it available instead of it being, the folks who need it, the folks who need it the most get it the at the end. We're making sure that they have the first shot at it. And so this is an equity piece as well. So this is all the way around the way that the opioid response team, Heidi and her team, has designed and developed this opportunity is just really exciting. And I don't know that we've seen this type of effort around something so important in a very long time.
Thank you. So, my next question is this sounds very exciting. And as we're getting into these warmer months, certainly we see more uptick in substance use and overdose. I'm sure the listeners would be interested in the plan for rolling this project out. Either of you care to discuss that?
Yeah, well, we are going to have an event at the end of the month, and that's going to be our kickoff for rolling it out. We have purchased the medication. That's the big piece, the big funding piece that we came to the table with. And then we have our contract in place with M Health Fairview, and then our partners in place, as I mentioned, the Hue-Man Partnership, the Native American Community Clinic. Dr. Ronda is involved. And just really, we had to develop some protocols around it. We have to get our outreach pieces in place so that we have our our peer recovery specialists and our navigators that can help walk these individuals that are participating in this pilot, like I said, from treatment into long-term recovery. And so the kickoff the end of the month, and then we're gonna get moving on it as quickly as possible to get this medication out into the community. As I mentioned, we are partnering with the Elliott Park Neighborhood Association. That's where we're targeting this pilot. The reason why we're targeting Elliott Park is because it's one of the highest areas where we see overdoses, we see addiction, we see use, and we also see a number of encampments. It's also in an area where there's a high population of Somali community members and then a high population of Native community members, which are two populations, as you mentioned earlier in the podcast, that are hardest hit by this epidemic right now.
Yeah, and so I think we kind of touched on it, but I just want to circle back to it. It is very obvious that the city of Minneapolis is committed to health equity. I think we kind of talked about it, but just making sure that the listeners understand the intentionality of how you're ensuring that communities hit hardest are really having access to Brixadi in terms of even being able to afford it and then how it would be given. So is this a medication that people have to pay for, or is it covered under settlement dollars?
That's a really great question because this is a hard drug to cover with insurance and it's expensive. So the city of Minneapolis, as I mentioned, we did have funding set aside to purchase the medication. So that was what we came to the table with was a couple $100,000 to purchase the medication so that people don't have to pay for it and they can get it for free.
Thank you. Anything you want to add on that, Commissioner? Or you?
Yeah, I think the idea again is to get folks into long-term recovery, and then to get them re-entered back into community. And so we want to end addiction long term. We want anyone, no matter where you're at in your addiction stage, that in the city of Minneapolis you have an opportunity to be in recovery, long-term recovery, and re-entry within 12 months or less. That's the goal. Is to get folks into long-term recovery. And so this gives us an opportunity to do that. And so, again, we're focusing on communities that are hardest hit. Oftentimes, you hear about these types of programs in other places, and they never really reach the areas where we think and we know folks are most impacted. But this particular time, we're starting right in the heart of the storm. And so, it's just all the way around. It's exciting. We're do everything we can to make all the pieces come together. And the city is really working hard to be a backbone for this work.
I would also add that even though we're providing funding and it's a limited amount, and we're going to be there's a finite number of people that we can serve through this pilot project in terms of that longer term journey. Anyone can go right now into the Riverside Emergency Department and be and be given this medication right now. So if you're here listening and you think this might be something that you're ready to try, it's available right now.
Yeah, and I think that's great that you say that. Again, we want to just highlight that this is just one pathway to recovery. It's one type of medication. Clinicians will certainly evaluate if you're a good candidate for this condition. But what I have seen and heard, especially with the work out of Fairview, is that they're not leaving people empty-handed or no tool if they're not a candidate for Brixadi. So that also for me is really important. Um, so my next question is, I heard you highlight like some of the partnerships that people that you've been working with, and I know historically, coming out of Minneapolis, being born and raised here, community trust kind of have the trifecta: the federal government, the city of Minneapolis, and then you throw in health issues. How have you all been working on building community trust?
Yeah, I mean that's part of this collective impact model that we're working on. It's really learning how we as government agencies communicate with one another, talking about how can we be more transparent with community, and then how can we communicate better with community about decisions that are being made, and then how can we involve those folks with lived experiences And so those are all part of this whole collective impact model that we're working on now. And to me, trust is a byproduct, right? It comes after things have been done. And so consistency is a big piece of that. Being consistent with your messaging, being intentional about your actions, and then telling people what happened. I mean, those are really simple things, but when you talk about it from a systems level, sometimes it becomes challenging. And so we're really working really hard to one sound, one band, one sound, one voice. So between the state and the county and city, that we really understand what the problem is, we understand what the diagnosis is, and we are in collaboration on what the treatment and the response is going to be. And so for us, that's how we can galvanize and build trust over time with communities, being consistent.
Deputy Commissioner, anything you'd like to add to that?
No.
Okay. We're going to just move on to, and you kind of already, Commissioner, thank you for your comments, kind of led into my next question already. We're kind of talking about like systems collaboration. Um, what does that look like? And then who are some of your key partners?
Yeah, I mean, I think we've mentioned them in this particular project, and we're lucky that we have great partners. We partner with Hue-Man Partnership, we partner with the Native American Community Clinic, we partner with federally qualified healthcare centers. And then of course, as the commissioner mentioned, with the state and the county. And so really working to make sure we're collaborating with the state and the county, um, especially with in terms of our funding sources and then our impact in the region.
Yeah, and I think we mentioned all those folks, Hue-Man, all those folks who are partnering with us for the LA Park. Um, we're looking to engage with the community as well. All those sister agencies that are connected to the work that we're doing. We went out and we met with the folks over on Franklin,
Southside harm reduction.
Southside Harm Reduction. Want to give them a shout out. Um, so we're looking to bring everyone into the picture. If you're a part of this process, if you're a part of this journey, we want to collaborate with you to figure out how we can leverage your resources, how we can leverage your experience, your passion, your information if you have it, your expertise. We're looking to collaborate across systems, whether it's hospitals, healthcare systems, FQHCs, as Deputy Commissioner Ritchie mentioned. We're looking to collaborate with schools. We have our school-based clinics have an opportunity to engage with students around opioids. And so we're looking to look across channels to bring in as many resources as possible so that we could be very prescriptive in our response.
I think that's wonderful. And I want to say I commend the city's approach on this particular issue. I know it can be challenging when you're looking to build relationships and establish credibility, but just from my personal perspective and being born and raised here, just the thought that's gone into, because it would be very easy to take this product, roll it out into community, not engage people, and not even present information in a way that people can understand. This is very clinical. I've seen you all work with resident experts to come in, who would come in at night to community meetings to discuss these issues. So that is just a wonderful job. I think other organizations at the state, federal, and local levels can really take some lessons learned from this. And I know you all are going to be collecting data and presenting that data back to the community. So thank you for doing that. As we're talking about opioid and settlement stuff, and I know this drug is very regulated, there are a lot of policy and infrastructure issues surrounding it. What do you think are some changes that could be made to kind of help scale up interventions like this?
I think I mentioned one of them earlier, which is the difficulty with some of the DEA requirements with Brixadi, and in particular, just the accessibility and where it can be administered. And so I think that's probably right now one of our biggest barriers, biggest challenges. So if we, if there was a change at the federal level to have a little bit more flexibility around that, that would greatly help us get this out.
Yeah, the other opportunity for scaling up from a state perspective is that if there are other counties and cities and towns who can replicate this relationship between the state, the county, and the cities, that's a game changer as well. Getting having this relationship with the FQHCs is a game changer. It allows us to expand and reach areas that maybe we're not able to do with the medical mobile unit or even with our first step program. And so it's not just about getting the product to people. It's about making it accessible to people no matter where they're at. And so there's a ton of opportunities here. For me, I mean, I'll say this: we have a 7 day delivery for the product. We have a 30-day delivery of the product. I would love to see a 90-day delivery on the product where it's extended, the release is extended over 90 days. And so those are things that I'm looking forward to the product. We just have an opportunity that we just have not had in the past. And so this cycle of folks going in and out, ebbs and flows in their addiction, it just makes it very difficult for us to get involved.
I think there's a couple other things that you had mentioned, Dr. Rhonda. One, education. And part of the rollout, and I didn't mention this, but part of the rollout is really that education piece. And so that's, helpful for our partners, helpful that we have you to help us be able to explain this in a way that's not, um, that's easy to understand and it isn't complex and filled with clinical jargon. I think the other thing that I've seen and heard about when talking with other people doing this work is the comfort level of doctors in prescribing these medications. So I think there's an educational piece, not just with the community, but also with providers. And so we need to get more providers comfortable prescribing this drug. It's not just Brixadi, it's the other, some of the other MOUDs that they have some very specific dosing. And also if you don't get the dosing right, then the person doesn't feel good and they don't want to come back and things like that. So I think that education piece around the community, around the providers, and then with kids, because what we're looking at in schools is people are using substances younger and younger, and these are stronger. These are not the types of substances that we had 25 years ago. They're a lot more potent, and not just fentanyl, but cannabis as well. And so getting into the schools and trying to help kids understand about the health of their brain. So there's a lot of focus on physical health in schools. So we want to bring curriculum, neuroscience curriculum into the schools, into the middle schools in order to help educate kids how to take care of the health of their brain.
That's wonderful. And as we're getting close to wrapping up here, next stage we want to talk about is the future of opioid treatment for the city of Minneapolis and kind of where do we go from here. Um, and if you could really specifically kind of comment on your mobile health unit, which I think is something else that's a little bit different than other cities and counties are doing, that would be great.
Yeah, so I talked a little bit about the mobile medical unit. It's a very large unit. It's like a coach bus, and we've got one of our peer recovery specialists and opioid response team members is our driver, and so we've got that expertise built in. We've also hired 3 nurses, a nurse practitioner, and a medical director, and that will help us with prescribing authority and being able to be flexible with the types of services we can offer. We have a dental chair in the unit. That's one thing that came out of our community conversations is that there's not enough access to the dentist, and so we put that in there. It's also ADA accessible, and so we can help anyone, anyone who's walking or rolling or anything like that. So we also their private exam rooms. And we want people to be able to feel comfortable when they're seeing a nurse and have their privacy. Just because it's a mobile unit doesn't mean we're not going to have that comfort and that privacy and that dignity. And then one of the things we really want to use the mobile unit for is just really going to the places where people don't have access to the traditional healthcare. So, you know, healthcare is generally available during working hours, during business hours, so to speak. And so it's difficult for people who work during business hours or have other schedules or have kids or have transportation issues or don't have houses. And we can take the unit out to them. And so that's kind of the biggest piece is being able to provide that accessibility. And then being a link be to primary care. And so working with our federally qualified healthcare centers in order to have that referral relationship so that when we do see someone for a wound or for a checkup or for a dental visit, we can help them get into primary care so that they can have some more of those preventative pieces and just really live a healthier existence.
Yeah, the mobile medical unit is not a new thing. It's new for Minneapolis, but you'll see them all over the country. We're able to bring the product to the people, so we're able to go to some of these spaces, whether there is an encampment or another location. We're able to really be prescriptive about where we're intervening, and that's the biggest deal. Could we do this, and could we scale this down and do this with regular electric vehicles? Sure, we could. But the idea is to get the model in place and to see that it works. And then there's tons of opportunities from there. As Deputy Commissioner Ritchie mentioned, this is complex, right? We're talking about the project because we're excited about it and we want people to know about it. But this is very complex. It's complex on the medical side. It's complex on the clinical side. It's complex on the delivery side. It's complex on the finance side. And so we're trying to uncomplicate something that's very complex and make it very accessible to folks who normally wouldn't be able to get access to these types of drugs. And so the medical mobile unit is the Taj Mahal of the medical delivery services. And so it has all the things that Deputy Commissioner Ritchie mentioned. But more importantly, it has the ability to go in spaces where an FQHC may not be, where a physician may not be, where there may be a medical or a healthcare desert. It's able to go into those locations. So that's really what makes it unique and innovative.
Yeah, and I think what also makes this very unique and innovative is that this is very person centered. So often when we talk about addiction or substance use disorder, we look at just reducing people to that condition. One of the reasons why I'm actually very passionate about this project is that the medical mobile unit is providing people an opportunity to look at their blood pressure, diabetes. Um, we're talking about dental care and really allowing them a pathway to
Hmm.
kind of re-enter society by taking care of their health needs. And so I think that part is really important. As we wrap up here, what advice would you give to other um, healthcare leaders or cities that are considering Brixadi? And then also, I just want to make sure we highlight that Brixadi isn't something that's just administered. There's certain requirements that go with that. So if you could touch on that, that would be great.
First advice I would say is be hopeful. Number one, be hopeful. Number two, stay, as you mentioned before, person centered. That these are people that we're dealing with and fight the stigma. The third thing that I would say is do your homework. This is, like I said, this is not easy. This is a complex strategy. And so you have to do your homework and understand it's not for everyone. Everyone doesn't fit the profile for this particular intervention. But it's worth the time, it's worth the effort. If you can save one life, if you can change one life, if you can bring one family together, bring one community together, I think it's worth it. And so I would just say be hopeful. There's hope, um, and be ready to pivot if you need to. Be ready to make the change.
I really like the person-centered approach because it's not just about addiction. Most people who have challenges with addiction have challenges in other areas as well, with employment, with housing, with their families. And so I think that a person-centered approach and this the way that we're intentionally trying to roll this pilot project out is to address the whole person. And so yes, we are focusing on this medication, but our partnerships with folks and the folks that I mentioned also provide services beyond just the addiction treatment and the medications. So help with jobs, help with housing, help with food, help with family relationships. And so really that is what that person-centered approach is about, is seeing that person as a whole and real person that we want to help um, live up to their potential.
And I just kind of before we close out here, I think you selecting Brixadi says a lot, right? There are certain, we talked about those regulatory requirements. This medication requires people to be connected to resources. So selecting that medication, you could have went with something that people use daily. This says that you're really committed to connecting people to the resources that they need to be the best version of themselves, and then having a model that's flexible. Commissioner Chaplin, Deputy Commissioner Ritchie, I want to thank you so much for being here today. It's an honor and privilege for you to just sit here. And I like I said, as a young lady growing up in Minneapolis, this is a kind of a dream come true to see a project where we take evidence-based medicine, bring it to the community, give the data to the community, but also let community really say how these interventions look. So I want to thank you for that. Are there any closing remarks that you have?
Well, I would just like to thank you, and not just for having us today, but for all your continued partnership, and working with you is great. So thank you. Um, and I guess I would just say that this is hopeful. And I, like you, I was born and raised in Minneapolis, and I have seen it ebb and flow. And I'm really excited that that not only are people like me and you who work in this area excited, but I actually see hope in the community, uh, and not just the community that has loved ones who are facing addiction, but people who are struggling with addiction themselves. They're talking about this with each other. And I think that is something that we haven't necessarily seen. And I think it is because this medication does a little bit better of a job dealing with withdrawal and keeping people in a state where they're just they don't feel like they want to crawl under a rock and die, which is what withdrawal can feel, which is why people keep going back to the substances. And so I think that is something that I am encouraged in hearing community members talk about it. We can be excited all day long in the provider area, but if the end user and the consumer of these services, if they're not bought into it, then it's not going to go anywhere.
And I like to start by thanking the mayor and city council for allowing us to get this product into the field. Without them, we wouldn't have been able to do it. I also like to thank our health department and our opioid response team that has been led by Deputy Commissioner Ritchie. They've been um, stellar in their approach to this. They've been flexible, and they've been productive. And so I want to thank them and the entire health department. I also want to thank you, Rhonda, and Dr. Nataba, and Clarence, for giving us this platform. This is part of the communication. This is part of the strategy. This is part of the solution. This is part of the prescription, is being able to get on a platform and talk about um, these very exciting projects, but more importantly, what's available to the community. And so we're doing the right thing at the right time in the right way. We're taking a slow approach to this, but we're cautiously optimistic about what could happen going forward. And so I could see a day when we're talking about opiates like it was way back when, like remember the day when. And so this gives us that pathway forward. So I want to say thank you to you. I want to say thank you to Deputy Commissioner for joining me, Commissioner Ritchie for joining me. Clarence, thank you. And thank the spokesman for giving us this platform.
Yes, and thank you to our listeners. If you'd like to learn more about Brixadi or access to opioid support services, check our show notes. This is For Your Health. I'm Dr. Rhonda Marie Chakolis-Hassan, and stay safe, informed, and take care of your health.